Hi everyone, hope you're doing well from wherever you're watching this channel, depending on your time zone. Now, doctors have been on strike from March 13. It is continuing and they're closing a month. In this move, we saw also clinic officers joining the strike. And now, the worst is that doctors are trying to reach out to those in private hospitals to join this strike by closing the facilities so that the government will have no option but to listen to them. If it goes that direction, then we are finished as a country, as long as Ruto is not willing to listen to them. With this move, for the first time from the time this strike started, ODM leader Raila Odinga is now coming out to speak and is urging government to try and sort out this mess. There is three key broad areas where he's touching about. Number one, payment of interns. They have been earning 206,000 Kenyan shillings, and Ruto was proposing to give them 70,000. So imagine 70 is like you divide by 3 and give one. These two nabaki nazo hata sio nusu ya hizo. So Raila is telling them, give the amount that was being given by a previous regime until the next negotiation is when you will have a new way of understanding going forward. He has really explained that very, very clear. Number two, in terms of fees and salaries to doctors who have been involved in the further studies. The county government need to pay the doctors. Of course, they've been doing so. But again, the national government need to facilitate their learning in terms of paying school fees. William Ruto's regime is not paying that fees. A big problem whereby doctors will now delay even in the learning institution rather than coming back to give service. I don't know if this is the trend. Then in the future, will we really have well-qualified doctors in this country to serve us, or will we be depending in other countries? Kwenda India na kwingine huko. Kama tutafacilitate hawa madaktari wasome vizuri ili tuwe na well-qualified doctors. Sijui kutakuwa namna gani. Lastly, doctors on contracts. Some county governments are giving 3 months contract, 2 months contract, 1 month contract, which is unfair. The contract is too short. Raila is trying to address that, and it is something is urging the government to take it seriously and work on that. Then lastly, equal pay across the country, the counties. Some counties are paying low, other ones nicely. There is a problem with this. So doctors should have a way whereby if you want to employ these doctors, there should be an equal payment across, so that county government will not be left with a way where now they have to decide what amount they should pay you. It should not happen that way. Many will agree with Raila Odinga on those points, and I want to leave here with the entire press from Raila Odinga. Listen to him, subscribe, comment, share, like, and see you in our next video.
Okay, ladies and gentlemen of the press, this one is not about the ODM. This is about the doctor strike. We have reviewed the fact that members of the 7,000 strong Kenya Medical Practitioners, Pharmacists and Dentists Union have been on strike since March 13th to demand better pay, and the strike has disrupted healthcare in the country's 57 public hospitals. We are of the view that the situation is moving from bad to worse, and soon we will have a full-blown crisis in which all health workers will down their tools. Already, clinical officers have joined. I therefore have a personal appeal to both the government and the doctors. After very wide consultations, I am convinced that the doctors and all other health workers currently on strike will be able to craft a return to work formula and resume duty if the government were to meet their demands halfway while negotiations continue. We therefore appeal to the government to address itself to the following three broad areas as a way of progress towards ending this strike. 1. Pay for medical interns. For the last 7 years, interns have been earning 206,000 shillings per month. These are actually the doctors running level 4 and many other public hospitals. There is no way an employer can reduce the salaries of employees midstream. That distorts everything in the life of the employee. I therefore ask the government to reinstate the 206,000 shilling pay for interns until the next CBA negotiation, which is around the corner, kicks in. During that next round of negotiations, both parties will put their cases on the table for consideration. 2. Fees and salaries for doctors pursuing further studies. Counties are supposed to pay salaries of doctors who are enrolled for further studies like a master's degree, while the Ministry of Health is supposed to pay fees. My understanding is that while counties have kept their side of the arrangement, the Ministry of Health has failed to do so since 2018. As a result, a number of doctors cannot complete their studies and graduate because of fees owed. And as they retake courses, counties have stopped their salaries because those doctors have overstayed in the college. I urge the Ministry of Health to immediately engage the doctors and their learning institutions with a view to clearing the fee balances and enable the doctors to complete their studies. The ministry must also engage counties to resolve the issue of pay for doctors who have overstayed in the college through mistakes not of their own making. The ministry should also work out a plan for paying stipends to doctors who forego county salaries and ministry fees and privately fund their higher education while offering services in public hospitals. Such hustles should be supported. 3. Address the problem of doctors on contract. I have been shocked to learn that some of our high-end hospitals are hiring doctors on as short as a month, 2-month or 3-month contracts. This is wrong. The ministry is failing to stand up for the doctors to prevent their exploitation and exposure to the unfair practices. This ministry must lay down the rules that ensure fair, respectful, and sustainable labor practices by both the public and private health providers. 4. Equal pay for equal work. Doctors are complaining about a free-for-all system where some employers have the free hand to decide what to pay. The result has been a very unequal system where doctors hired to do the same job experience huge variation in salaries. The medical profession is too important to be managed so casually. The ministry must intervene for the doctors. 5. And procedural termination of services. I have terminated contracts of the doctors for one reason or another to reconsider their actions and engage the doctors. The counties that have done so or are in the process of doing so know themselves. I request them to reconsider their steps. I believe that the above actions, if taken in consultation with the union, will see us avert the crisis that's building up in the health sector and pave ways for less antagonistic engagement. This is a crisis that has serious ramifications. We want this crisis to be resolved. We have not spoken before, but we want the government to take notice that we cannot remain silent for a longer time when this is persisting. We ask them to act now. And if they don't, of course they know that the consequences will be very grave indeed. Thank you very much.
Thank you. There are no questions?
Okay.
Thank you.
Very elaborate.
We are going to give you copies of some documents. This one is
Thank you.
your handkerchief.